ever-evolving landscape of modern technology and scientific discoveries, the medical field has witnessed remarkable advancements, propelling us into an era of unprecedented progress. Yet amidst this progress, a peculiar phenomenon persists, a lingering fear among many individuals when faced with the prospect of visiting medical institutions. This fear, it seems, is deeply rooted in the human factor, a remnant of a time when medical practices were far from the refined and evidence-based approaches we know today. Delving into the annals of history, we find that the fear associated with medical practices was once grounded in a different reality. In ancient Babylon, for instance, darkness was deemed the culprit behind most diseases. The concept of illness was intertwined with the supernatural, with ailments viewed as the work of dark forces or divine retribution for earthly transgressions. The remedies proposed were equally eerie. One cult prescribed a peculiar treatment for the sick, sleeping on a human skull for a week, licking it to absorb its essence, in the belief that this ritual would expel evil astral bodies. As the centuries progressed, the Iron Age brought about a significant shift in the perception of illness. Many civilizations began to dissociate disease from the wrath of the gods, marking a pivotal moment in the evolution of medical understanding. However, the fear and skepticism towards medical practitioners remained pervasive. During this period, therapeutic cannibalism emerged as a common practice, revealing the desperate measures people took in the pursuit of health. The ancient Romans, for instance, believed that consuming the blood of gladiators or warriors could treat epilepsy. Eating the remains of the deceased was a popular method to transfer their life force to the sick, a gruesome attempt to combat disease. The treatment of migraines involved crushing skulls into powder, a laborious process that yielded a medicinal substance. In the Greek province of the Roman Empire, bloodletting was a prevalent medical procedure, employed for ailments ranging from the common cold to the plague. Barbers, in addition to their hair-cutting duties, offered their services in this macabre field, puncturing veins and collecting diseased blood in the belief that it would restore the body's internal balance. Astonishingly, this dangerous practice persisted for centuries, even finding its way into our modern era. The pus of plague victims was also considered beneficial, reflecting the desperate measures people took in the face of deadly diseases. One of the most horrifying methods involved puncturing the buboes of patients dying from the plague and inhaling the contents through the nasopharynx or injecting it under the skin of healthy individuals. This nauseating procedure, devised by physicians, was a desperate attempt to confer immunity to the plague, a disease that had ravaged populations for centuries. Psychiatric hospitals of the past employed devices to restrain violent patients, immobilizing them and preventing any movement or activity. These contraptions, while effective in controlling patients, were far from humane. It wasn't until the 10th century that these devices were replaced with restraining shirts and rooms with soft walls, a significant step towards preserving patient dignity and freedom of movement while ensuring the safety of others. For a considerable period, doctors attributed the cause of illnesses primarily to mental states. The focus was on expelling evil spirits and curses, rather than addressing the physical manifestations of disease. In the 15th century, a physician named Rush introduced the tranquilizing chair, a method that involved tying patients to a chair and compressing their skulls with pincers. The belief was that madness and bad blood would exit through a vessel placed under the chair, a crude and misguided attempt to expel insanity. In the 2nd century, Chinese alchemists were captivated by the allure of mercury, believing it to be a magical elixir that could grant immortality. Despite its well-known toxicity, they used it in ointments and even ingested it. The quest for immortality led the ruler of the Celestial Empire, Qin Shi Huangdi, to attempt poisoning himself with a poisonous tablet. Mercury's use extended to treating sexually transmitted infections until the 10th century, but its application often resulted in patient deaths due to kidney failure complications. Dental health has long been a source of intense emotional responses. In the past, the field of dentistry was divided into professors, theorists, and bath attendants, practitioners. Interestingly, well-educated theorists often lacked practical skills, while uneducated practitioners gained invaluable experience from their ancestors. Treating diseased teeth involved manual filing of cavities or the use of various tools, sometimes even incorporating poisonous substances in a misguided attempt to eradicate oral flora. Denture prosthetics, as one can imagine, were in their infancy. Animal teeth, elephant tusks, and even fragments of human teeth from warrior graves were used as replacements. These primitive prostheses were secured inside the mouth with wire or wax, a far cry from the sophisticated dental solutions we have today. More humane alternatives to tooth extraction existed, such as the moonlight method, where patients were advised to sleep with their mouths open under the moonlight to relieve toothache. While painless, this method was entirely ineffective. The 15th century marked a significant milestone with James Beam Morris's patent of the dental drill, a breakthrough in dental technology. This invention revolutionized dental practices, but it coexisted with a terrible operation where doctors cut off half of the tongue of stuttering patients in a misguided attempt to cure their speech impediment. This barbaric method, performed without anesthesia, often resulted in patient deaths, highlighting the stark contrast between progress and ignorance in medical practices. The treatment of scoliosis has also evolved significantly. In the past, patients were subjected to hanging in unnatural positions, bone-breaking procedures, and BDSM-like corsets that distorted the body. These methods were not only painful, but also ineffective. Fortunately, modern scoliosis treatment offers much more humane and effective solutions. Metal rods are used to reshape the spine, and devices for posture correction provide a more comfortable and successful approach. The contrast between the old and new methods is stark, and we can be grateful for the progress that has been made. The journey through the history of medicine reveals a fascinating, yet often disturbing narrative. From ancient superstitions to the dark practices of therapeutic cannibalism, bloodletting, and the use of toxic substances, the medical field has evolved significantly. The fear and skepticism that once surrounded medical institutions were not unfounded, given the often brutal nature of treatments. However, the relentless march of scientific progress has led us to a point where medicine is more humane, effective, and evidence-based. The contrast between ancient and modern medical practices is a testament to the power of knowledge and the human capacity for innovation. Today, we can look back at these historical practices with a mix of fascination and relief, grateful for the advancements that have transformed the medical field into a beacon of hope and healing. As we continue to push the boundaries of medical science, we must remember the lessons of the past, ensuring that the human factor remains a force for good, guided by empathy, ethics, and the relentless pursuit of knowledge. The evolution of medicine is a testament to our collective resilience and the boundless possibilities that lie ahead.